Ted.
Well, Mark and Lori, that project will only work if 1 million Americans agree to share their medical info with the National Institutes of Health. That's the nation's medical research agency. Many people may be skeptical of this effort at a time when it seems like our data is more vulnerable than ever. But doctors say this project could soon provide a much more clear picture of your health, including risks for diseases and ways to better treat them.
Eric Dishman wants you to consider sharing something personal. Medical records, vital signs, maybe even a blood sample. He's leading a new national effort to create a massive collection of data, which the federal government will use to develop new treatments and expand our understanding of diseases like cancer. The project, called All of Us, is totally voluntary and aims to collect health info from 1 million Americans. UW and the Seattle-based Brotman Beatty Institute for Precision Medicine are partners in the research.
The number one motive for everybody is still, I want to give back to future research. I don't want my kids and I don't want my kids' kids to deal with the same health problems that either I have personally or my family.
So what's in it for you? All of Us will share with you and your doctor new info and insights about your health and yet to be uncovered breakthroughs, which could help you understand your risks. 75,000 people have already made it through the first stage of data collection, and a majority of those participants are from medically underrepresented groups.
We have got to get racial and ethnic diversity, socioeconomic diversity, geographic diversity, because we just don't have it in the science, and thus we're not developing cures for those people.
This work is only possible today because of advances in mapping the human genome. It's basically the unique picture of your body's DNA. Dishman, who was diagnosed with a rare form of kidney cancer at age 19, was once close to death until he had his genome mapped, providing his doctor with much clearer instructions on how to fight the disease.
I am healthier now. I just turned 50. I'm healthier now at 50 than I was at 19. Thanks to whole genome sequencing and the pain and suffering of getting my whole electronic health record from those 23 years of treatment that I had.
To learn more about the All of Us effort and for instructions on how to sign up, text HEALTH to 206-448-4545 and we'll provide a link to that website. Let's talk about security concerns for a moment. How safe is the data people are handing over? All federal research is protected by a law that guarantees confidentiality. Anybody who touches that info has to protect the identity and privacy of the patient. They cannot even share that information with law enforcement.
So Ted, a couple of questions. Is it free, and do we just go to our doctor and say, I want to sign up, or how does it work?
The whole thing is free. It's funded by the federal government. It really involves just filling out questionnaires online, sharing your health records. Some participants may be asked to go to a clinic, again for free, so a doctor or a nurse can gather measurements and then test your blood pressure readings and some other tests that are important for this.
Okay.
Thank you so much.
Keep us posted. Thanks, Ted.